In this video we're going to spend 2 or 3 minutes talking about the complications of local anaesthetic. Now, please remember that local anaesthetic is extraordinarily safe, and the drug itself and the other components in the car pill that is used to give local anaesthetic are all designed to make local anaesthetic very safe. Clearly, it's very safe as long as you follow some fundamental core rules in the application of this drug. For example, the two important rules when giving local anaesthetic is to always give it adjacent to bone, and to always give it after you have aspirated. Now, what that means is that with modern dental syringes, you can actually put a negative pressure in the car pill and drag solution from the patient back into the car pill. Aspiration, if you see blood come back into the car pill, you'll know you're in a blood vessel, and that increases the risks. So therefore, using aspiration is an essential core to giving LA safe. So following these two very basic rules makes local anaesthetic extremely safe. Now, notwithstanding that, there are some complications that do come from local anaesthetic, and what we do is we group these complications into two groups. One of local complications firstly, and then later we'll talk about more systemic complications. The first local complication that we always talk about is spread of infection. Now, there's some really simple things here to prevent this happening, but just so we understand what we're talking about, if you push a needle through an infected area that is full of bacteria or pus or such like, clearly those bacteria and debris is going to collect on the needle and be transmitted further down the pathway of that needle. So when we talk of spread of infection, what we're saying is don't inject into infected areas, don't push needles through pus or bacteria or those sorts of things. The second complication is a hematoma. In other words, what's happened here is that the needle has damaged some blood vessels, usually small veins, as it's transversed through the tissues. And this damage has led to bleeding within the tissue, and a hematoma is really a posh word for a bruise. So sometimes patients will return and say, look, I've noticed in the back of my mouth this large purpley area following my dental treatment. And really that is you've damaged a blood vessel on the journey and you've got some bleeding in the tissues. Now, for most people that's not an issue, but for people at risk with conditions like haemophilia or Christmas disease, people suffering from bleeding disorders are at higher risk of hematomas, and appropriate advice is needed before you give local anaesthetic in these cases. The third local complication is nerve damage. Now, this is extraordinarily rare. To actually physically damage the nerve with a needle or any nerve on the journey is extraordinarily rare, a very low risk complication, a low probability complication. However, it does happen, and what patients often return with is symptoms of tingling in various regions, the tongue or any of the distribution, so tingling, or very rarely numbness, those sorts of things. Now the good news is peripheral nerves normally will actually regenerate and re-heal from that sort of very minor damage. So the long-term effects of this is very small, but there is a small risk of this happening. And the last local complication is one that's not uncommon, and that is the accidental injection of the seventh nerve, the facial nerve. And those who haven't brushed up on their anatomy recently will need reminding that the facial nerve actually runs through the parotid gland, and the parotid gland sits just behind the mandible, and bits of that parotid gland can ooze around the back of the ramus of the mandible right to the region where the mandibular foramen is, a little bit posterior to the mandibular foramen. So if you go a little bit too deep with your needle, or your needle doesn't actually touch bone when you're giving the local anaesthetic, you can give it into the parotid gland and it can spread and affect the facial nerve. Now for a patient, this is probably the most traumatic, immediate local complication that can happen. Clearly when you affect the facial nerve, all the muscles of facial expression sort of droop. It looks somewhat like having a stroke. So clearly this causes great concern for a patient. The good news is that obviously it will wear off, and there's things that you need to do if that ever happens, and that information you need to gather from somewhere else exactly what to do. But really the most important thing is to assure the patient that it's only temporary and that this will resolve. So they are the local complications that we commonly talk about for local anaesthetic for dental use. Let's now go on and talk about the systemic complications. And these systemic complications come in a whole series of sub-complications. The first is obviously infection. This gets a Guernsey in both the local and the systemic complications. Clearly, if you're going to push bacteria and cell debris and viruses and things through tissues, not only will you get a local infective response, but you could also get these distributing to lymph nodes and systemically, so infection can be a risk. Clearly you need to follow appropriate aseptic techniques when giving local anaesthetic, and that will be part of clinical training. The other systemic complications are relatively small in this day and age. Clearly anyone suffering from any cardiovascular disease is at risk because local anaesthetic, the actual drugs that are used, some of them interact with cardiac tissue and cause cardiac changes. Also, some local anaesthetics have vasoconstrictors that run the risk as well with patients with cardiovascular disease. However, although this is a complication and a risk, this is not something that precludes the use of local anaesthetics. So it's to be aware of, but it's not preclusive of local anaesthetic. Patients with severe liver disease are at risk with local anaesthetic. The actual molecules itself are often degraded in the liver, so if they've lost liver function they are at risk from a slow degradation or a lack of degradation of the local anaesthetic molecule. And similarly to cardiovascular disease, advice needs to be sought with patients with liver disease before giving local anaesthetic. And then there's some rare conditions that can complicate and cause complications with the use of local anaesthetic. For example, pseudoesterase deficiencies. I'm just going to write pseudoesterase deficiencies. Again, the problem with those is that the sum of local anaesthetics, the ester-based local anaesthetics, aren't degraded properly in patients with these sorts of enzymic problems. And the other condition that we commonly talk about is methemoglobinemia. But these are rare conditions that you just need to be aware of that can cause complications with giving local anaesthetic. So in summary, on the whole, local anaesthetic is a very safe in proper usage terms. So the complications, although present, are relatively minor, and most, in normal circumstances, are very rare. But remember to be safe. The key things about being safe is about the methodology that you give local anaesthetic. You need to be adjacent to bone, and you need to aspirate. And in fact, the tip that we give to all students when they're giving their very first local anaesthetic is that if you forget everything else in all your learnings, just remember those two things, and that will keep you safe when you give local anaesthetic. Thank you.